Good morning, everybody. Today we'll have a discussion about drugs, drugs which are used in uh, diabetes. So the drugs, today's topic is insulin and the anti-diabetic drugs, the drugs which are used in diabetes mellitus. And we'll discuss about a brief introduction about the drugs which are used in hormone-related drugs. So the first thing is diabetes mellitus. What is diabetes mellitus? Diabetes mellitus is a condition is defined as elevated blood glucose level associated with absent or inadequate secretion of insulin that is produced in the body with or without concurrent impairment of insulin action. This is something diabetes mellitus. So basically, what is diabetes mellitus? It is sugar, sukkar. So the condition where the imbalancement of blood glucose level will occur, and it can be increased or decreased, or hypoglycemia or hyperglycemia, these two type of conditions. And based upon that, like the treatment will be given. In the maximum cases here, the blood glucose level will be in elevated level. And this elevation of the blood glucose level could be because of any of the reason. It can be because of like accidental damage, or it can be because of less secretion, it can be because of disease condition, and generally there are so many factors that influence over here, like age, obesity, etc., etc. So the diabetes mellitus is an insulin production will be disturbed, like when compared to the normal individual. So coming to the insulin, what is insulin now here? Insulin is a hormone that helps the glucose into the cell to produce, to form, or to give energy. And the body does not make enough insulin. In some, when this diabetes mellitus occurs, when the body does not make enough insulin production in the body, or it can be sometimes does not make an insulin, and sometimes doesn't use insulin well. So based upon the factor or based upon the diagnosis, the doctor will treat the patient. And glucose, then it stays in the blood and does not reaches to the cell. And over time, having too much glucose in the blood, that can lead to so many issues, so many problems. Now, what could be the problem? It can damage eye, kidney, nerve ending, may lead to the dental issues, may lead to the cardiac disease, may lead to the kidney disease, renal diseases, etc., etc. How do we diagnose? The process of diagnosis of this diabetes mellitus. There are two tests. There are few tests which is performed for the diagnosis of the diabetes mellitus to identify that the patient is suffering with diabetes mellitus or not. Fasting plasma glucose (FPG). This fasting means like it's the patient should not take any food or except water, like suppose for at least 8 hours. Generally, this is done in the early morning time. And the normal range should be less than 100 milligram per deciliter, but whereas pre-diabetic condition up to 125, and if it is more than 125 milligram per deciliter, then the patient is said to be a diabetic. And before that, 125 to 100, it can be a borderline. So here, and the oral glucose tolerance test. So fasting test, and then the oral glucose tolerance test, where OGTT is a short form. It's a 2-hour test that checks the blood glucose level before and after 2 hours drinking a sweet drink. It tells the doctor how much the body is processing the glucose. And the reading will be less than 140 milligram per deciliter, and in the normal case, and if it is more than 140 to 199, it is a borderline or pre-diabetic condition, and if it is more than 200 milligram per deciliter, then it is the patient is suffering a higher level of glucose present in the blood. And another diagnosis tool is random plasma glucose test. This test is a blood check at the time of the day its severe diabetic symptom persists and diabetic diagnosis at the blood glucose level is greater than the equal to the 200 milligram per deciliter. And HbA1c test, which allows also known as glycated hemoglobin HbA1c below the 42 millimoles per molar and 6% of non-diabetic conditions. But whereas 6 to 6.4, which impairs the glucose regulation in pre-diabetic cases, and if in the case of type 2 diabetes, which is like HbA1c will be 48 millimolars, that is 6.5 of or over. What are the risk factors which is associated that may lead to this type of condition, diabetes mellitus? Age, which is like about 40 or 45 or older, 45 and older ages. And family history of diabetic means like the parents are suffering with this type of condition, like it's a genetic, people say. So it can be like family history where the parents or the grandparents or whoever the family members are suffering with this. And overweight means excess of body weight, which is like more BMI will be like more obese patients, for example. And physical inactivity means the patient is not having proper physical activity. And certain health problems such as high blood pressure also affect the chances of developing by diabetes 2 types of diabetes. And the symptoms of this diabetic mellitus is urinating often, means the patient will be thirsty, and urinating more frequently means go to the toilet more frequently, feeling very thirsty, feeling very hungry, even though if after eating food. Extreme fatigue means weakness will be there, and blurred vision will be seen, and cut bruises. There are slow, the means like if the patient is having cuts and the bruises, that will take more time to heal when compared to the normal individual. And sudden weight loss will be there, even though you are eating more. So here the patient will having more weight loss when the patient is taking more excess amount of food. Tingling pain and numbness in the hands and feet. So these are the symptoms of diabetes mellitus. And types of diabetes. There are two types of diabetes mellitus, type 1 and type 2. The first one, the insulin dependent or the type 1 diabetes mellitus, where occurrence due to this can be occurred. This type of diabetes mellitus can occur because of beta cells destructions into the pancreas in the body, and serve or the absolute insulin deficiency in the body. And usually this is diagnosed in the children and the young adults, although it can appear at this any age. Insulin replacement therapy will be given to this type of patients, and injection of insulin will be given subcutaneously to the tissues to overcome type 1 type of diabetes mellitus. The next type of diabetes mellitus is type 2 diabetes mellitus, which is like more common, is a non-insulin dependent diabetes mellitus, where the type, its other name is type 2 diabetes, which is characterized by the resistance which is produced and the action of insulin in combination with the relative deficiency of insulin secretions. And the insulin is produced, but it is an inadequate amount or to overcome the resistance of the blood glucose. Because of that, blood glucose level means the glucose level in the blood will get rises. Individual may not require an insulin to survive up to 30% or more, will benefit the therapy to control the diabetes. Occurrence at this condition is can occur at any age during the childhood, more often in the middle age or the older people. So that's why we say in the previous slides, like here, about 45 years and family history above age. So here this can even occur at any age, but more commonly, most often, or more commonly seen in the middle age or the older people, means in the above 40 years or above 45 years of age. And this can be controlled by the initial treatment, which will be controlled by diet, exercise, and reduction in the weight. Because like we have seen the symptoms like loss of body weight and obesity, age factor, family history, etc. So here, because of that, like here, diabetes mellitus type 2 can be controlled by diet and physical exercise also. But like if there is no benefit will be reached to the patient by doing some physical exercise or diet uh, management, then the patient obviously has to undergo a treatment of diabetes. And now insulin. What is insulin? Insulin is a hormone, as we all know, and how this will be regulating. Insulin secretion in the body secretes, which is by pancreatic beta cells and stimulatory drug like sulfonylurea, meglitide, isoprotenolol, acetylcholine, inhibitory drug that this stimulates the insulin, the stimulatory drugs, and inhibitory drugs like dioxide, phenytoin, and vinblastine. The liver and the kidney remove the insulin from the circulation, and this liver removes 60% of the insulin from the kidney and remove 40%. And the mechanism of action of this insulin is act by binding to the insulin receptors on the cell membrane after a series of intracellular reaction. Increase in glucose uptake, increase glucagon synthesis activity, and increase glucagon formation. The mechanism of insulin here, the basic thing is that it is stimulate the storage of glucose in the liver in as a glucagon and in the adipose tissue of triglycerides and storage as amino acid in the muscle protein. It is also prompt utilization of the glucose and much causes muscle for energy, and insulin inhibits the breakdown of triglyceride, glycagon, and protein, that the conversion of amino acid into glucose and by a process of glycogenolysis. And insulin is not not given orally, because like it has to be given IV or subcutaneously. So here insulin is a hormone. Why it's not given orally? The reason because the insulin, whenever it is given orally, when it goes to the GI system, the gastrointestinal tract, then there is the degradation of insulin takes place. So that's why it is not given as an oral tablet. So that's why whenever we want to treat any patient who is suffering with diabetes type 1 type of diabetes mellitus, so that's why, or the patient who is also having a less insulin production in the body, and we want to give an insulin replacement therapy. So in that case, that's why we give subcutaneous route of injection. So injectable type of treatment will be given. The reason because of degradation in the GIT. Therapeutic uses is in the case of IDDM, diabetic ketoacidosis, and diabetic coma. So in the case insulin, in which condition? Insulin dependent diabetes mellitus, diabetic ketoacidosis, and in the case of diabetic coma, the insulin is given directly subcutaneous or the IV route to the patient. DKA is a life-threatening process where the medical emergency is caused by inadequate or the absent in insulin replacement occur due to type 1 type of diabetes mellitus. Next comes here the oral anti-diabetic agent, the drugs which is given orally. So here we were talking about the insulin which is given subcutaneously or the IV route of drug administration. But now we are discussing the drugs which is given in type 2 type of diabetes mellitus. So these drugs can be given orally so that controls the blood glucose level in the body. So what are these oral anti-diabetic agents or oral anti-diabetic drugs? Sulfonylurea, first generation, a drug that is tolbutamide and chlorpromide, and second generation drug is gliclazide and glipizide. The class of drug, the second class of drug is biaguanide, that is metformin. So metformin is a very good choice of medication in the maximum cases of diabetes mellitus, until unless the patient is not having any allergic condition which is associated with diabetes, associated with metformin. If the patient is not allergic or not having any adverse effect or the side effects is seen with metformin, metformin is the choice of drug for in the case of diabetes. Another class of drug which is third is magnetide, that is something repluglinide and nataglinide, and thiazolidines, that is rosiglitazone and pioglitazone. And the fifth class of drugs is alpha glucoside inhibitor, that is acrobose. So we'll discuss about each classes separately. Try to discuss like in a brief idea. Take a brief idea about how does these drugs are acting. The oral anti-diabetic agents like sulfonylurea that helps in the lower blood glucose level in the normal individual or normal subject in the case of type 2 types of diabetes mellitus. But this drug sulfonylurea, it is not used in type 1 diabetes. They provoke the release of insulin, means they will show some synergism effect when it is been given to the patient, shows the insulin for pancreas, increase the release of insulin by the pancreas. These drugs act on the sulfonyl receptor of the pancreatic beta cells, and that causes the release of insulin in the body. So that can be managed, the blood glucose level can be managed. And the oral anti-diabetic agents, like adverse effect of the sulfonylurea, is it may lead to hypoglycemic condition. Means what do you mean by hypoglycemic? It causes decreased blood glucose level. Decreased blood glucose level in the body, and non-specific side effects could be nausea, vomiting, flatulence, diarrhea, constipation, headache, etc. Weight gain. These could be the symptoms. And there is some hypersensitivity reactions will be also seen, like the skin rashes, hypersensitivity rashes, photosensitivity. What do you mean by photosensitivity? When the person come in contact with the direct sunlight or the UV rays, then it should show some sensitivity reaction. It could be rashes or it can be some allergic reaction that can occur. And transient leukopenia, rarely a granulocytosis, will be seen in this type of condition with this sulfonylurea class of drugs. The next class of oral anti-diabetic medication is biaguanide. So this is the most commonly used, clinically used drug if the patient is not allergic or not showing any adverse effects with this medication, with metformin. So this is most commonly given. It's only biaguanide. It is clinically used now is metformin. And it differs marked from sulfonylurea, cause little or no hypoglycemic condition, and it is a non-diabetic patient except in overdose. It may lead to hypoglycemic action, suppresses hepatic glycogenolysis cycles and glucose output by the liver, and it enhances the insulin-mediated glucose disposal in the muscle, and retard intestinal absorption of glucose, promote peripheral glucose utilization, and enhancing the glycogenolysis cycle, means breakdown of the glucose. And the adverse effect over here with this metformin is most common adverse effect will be seen if the patient is not compatible with metformin drug, that is abdominal pain and nausea, metallic taste will be developed, and mild diarrhea or tiredness. So the abdominal pain and this metallic taste, nausea, is the most common adverse side effects or the adverse effect of this bioguanide class of drugs. So who are taking metformin, they have this type of some adverse effects. So if suppose a patient is not taking any of this, a patient is not suffering with any one of these side effects, then metformin is the choice of drug for maximum physicians or the endocrinologist you prefer to give to the patient. Next is thio. The next class of drug is thiazolidines. That is something. The drug which comes over here is rosiglitazone and pioglitazone. The class is thiazolidines. So these drugs are usually used alone as a weaker hypoglycemic than sulfonylurea and vagonide, and it is used in combination to improve the glycemic control. And the adverse effect over here with this thiaglitazones or rosiglitazone or pioglitazone, these are the drugs which is given to the patient. It could be edema, weight gain, headache, myalgia, mild anemia. And in the long-term usage, cardiovascular event, congestive heart failure. Failure of oral contraceptives may occur with pioglitazone therapy, and ketoconazole inhibit the metabolism of pioglitazone. So ketoconazole, what is ketoconazole over here? So edema, weight gain, cardiac issues can be arises when the patient is taking this medication. And the contraceptives, if suppose the patient is female and if she is taking contraceptive, the failure of contraception can be occurred. And ketoconazole, what is ketoconazole? It is an antifungal medication where it inhibits the metabolism of pioglitazone. The next oral antidiabetic agent, that is acrobose, that obtained from the fermentation process of fungal actinoprane. It delays the carbohydrate digestion. So what this drug basically is given, it will delays the digestion process of carbohydrates and reduces the rate of glucose absorption. So here this drug will reduce the glucose absorption in the body and lower the postprandial hyperglycemia. So because of by this process, reducing the rate of glucose absorption and prolong digestion time and delays the carbohydrate digestion may lead to decrease, may lead to lowering the hyperglycemic condition. It is used as a first-line therapy in non-insulin dependent diabetes mellitus in adequate control of diet and adjuvant and existing conventional oral hypoglycemic agents. Adverse effects will be like flatulence, will be there in soft stool, diarrhea, abdominal cramps, pain will be there for the patient, and where it will cause abnormal liver function and skin reaction. What do you mean by skin reaction? Some irritation or some allergic reaction, rashes that might be developed. So based on the every individual patient. And this implication in the dentistry. So here why we are concerned about diabetes mellitus. Basically, so before we go into the slide in further detail, like what is diabetes mellitus? Diabetes mellitus, we have understand till now that it is because of increased glucose level in the body, isn't it? And here, when we come to the dentistry, why it is how it is related to the dentistry. So in the case of dentistry, what happened? The issue is the patient, whoever having any dental issues, okay, it could be because of some bacterial growth, some okay in the body or abscess, whatever it is. Clear? And that may lead to the bad breath or infection in the dental area. So because of that, this diabetes mellitus, because it is increasing the glucose amount in the body, so this will make directly or indirectly, it is making the what do you call, it will directly, indirectly, it will be increasing the bacterial growth in the mouth. And that may leads to the excessive bacterial growth in the body or in the dental area, and that can cause some caries, some dental issues, dental problems, or the fungal infection can be arises. So here, because of that, the diabetes mellitus is again an area of concern for the patient who is having some dental problems. So coming to the slide, like implication in the dentistry, what happened when the diabetes mellitus. So diabetes mellitus is associated with increased incidence of dental problem. Why? Because excess glucose in the body or in the blood that may leads to it is a favorable condition for the bacteria to grow, isn't it? So because of that, so here diabetes mellitus is associated with increased incidence of many of the dental problems like caries tooth, periodontal disease, oral candidiasis, or other infection. Why? Because increased glucose, it will be a favorable condition for the growth of bacteria or the pathogens in the mouth. Simple dental procedure like under local anesthetic do not usually poses a specific problem in diabetic, providing blood glucose level are well controlled. So if in the case of simple normal dental procedures, the patient will not have any issues like until unless the patient will be having a well controlled control means a non manageable controlled level of blood glucose level in the body. If suppose the blood glucose level is higher than the normal, then the procedures can cause some issues. Extensive dental procedures under general anesthesia, monitoring urinary and the blood glucose level, covers the preoperative period of the regular insulin by subcutaneous route. And severe uncontrolled diabetes may be given if the patient is suffering with uncontrolled diabetes, then the patient will be given IV infusion of insulin plus 5% of glucose during the procedure. In the case of this we are discussing about in the case if we are doing any dental procedure under general anesthesia. In poorly controlled diabetic patient, prophylactically antibiotics should be given. Now, if suppose in the case of poorly controlled diabetic patients, so prophylactic, body immunoprophylactic means the amount of the drug will be given, the higher dose of the drug will be given to the patient before we start the treatment. So that is something prophylaxis. Why we are giving prophylactic antibiotic treatment to the patient? This is just to avoid any bacterial growth that can be arises. Like suppose the patient is having some infection in the dental area and then you are treating that infection. And there's a possibility that because of that infection, after the treatment, the patient might under increases because what happened when there is in the dental procedure, blood, the things will come out. When the blood comes out and it is a favorable condition and the patient is diabetic and increased glucose will be there in the blood and that will be a favorable area or favorable growth condition for the bacteria or the pathogens in the mouth. So as to avoid this complications, what we'll do, we'll give prophylactically means like we give antibiotic, we start the antibiotic treatment before we do any dental treatment so as to decrease the amount or the number of bacteria in the mouth or to avoid any further infection in the mouth. Clear? So this is something about prophylactic antibiotic should be given. So here in the case of diabetic mellitus. The next thing is about glucagon. What is glucagon? So here this is glucagon. So till now we were discussing about the diabetes and the drugs which is causing diabetes mellitus. So in the case of diabetes, when the patient is having excess blood glucose level, then how we control that excess of blood glucose level and what is the implications in the dentistry. Now is glucagon. It is secreted by alpha cells of the pancreatic islets of Langerhans. It is facilitated by catabolism to store the glucose and increase glycogenolysis cycle and ketogenesis, and increase in blood glucose level. Used for emergency treatment and severe hypoglycemic condition when the patient is unconscious. When the patient is unconscious, in that condition, the glucose, while the patient is unconscious. Used for emergency treatment for severe hypoglycemia. So when the patient is, because of hypoglycemia, means decreased blood glucose level in the body, the patient become unconscious. So then what we'll do, we'll have to provide some glucose to bring the patient back to consciousness. So used in the glucagon, which is used in the emergency when the patient has undergone unconscious because of hypoglycemia, because of decreased glucose amount in the body. You might have seen like some patients like suddenly walking and suddenly they get fainted. So why? Because if the patient is diabetic and maybe the diabetic patient has not taken any food or food substance, any food like no breakfast or no lunch, something like that, and if they have work excess, then in that case what happens? The blood glucose level go down and the patient become hypoglycemic and become unconscious. So in that case, the glucagon will be given to the patient to bring back the. So that's why what we do to that those type of patients, we give some chocolate or some sugar candy, so to bring them back to the consciousness. So we are talking about that over here. If the patient does not respond immediately, a medical help will be given and the IV infusion of glucagon will be administered to this type of patient. The next thing is hormone and the hormone related drugs. So what are these hormone and hormone related drugs? Hormone is a substance. What is hormone? So what is hormone? So here we have studied that the hormone, any secretions, any substance that they produce, a chemical substance which is secreted by the glands is hormones. Like example, we have studied the neurotransmitter. What is neurotransmitter? Neurotransmitter, the secretion, the excreted, the secretion of nerve ending. It's called neurotransmitter because it is secreted by the neurons. What do you mean by hormone? Hormone is a substance that is secreted or released in the body by glands. It can be any gland. It can be gland, pituitary gland. It can be thyroid gland. It can be adrenal gland. It can be any glands. So the glands which is secreting a substance that's necessary for the body, that is something called hormones. So that's why we say hormones are the substance of intense biological activity. So here the hormones are produced that will involve in intense biological activity, means in the body it shows a major role play activity that produces by specific cells in the body and transported through the how it's transported through the circulation act by act and goes leads to the targeted cells. So here the hormones is produced by the glands and it is regulated with the help of blood and it will go at the site of the targeted cell and shows some effect. Hormones are secreted by the endocrine gland. So here we're talking about like hormones can be produced by like pituitary hormone, like growth hormones, like thyroid, thyroxine hormone, adrenal, steroidal, pancreatic, insulin. So these are the different hormones which is produced by different glands in the body. Coming to the pituitary gland, the hormone, it is an anterior part of the body in the brain, and it produces the growth hormone that is growth hormone, or otherwise it is also called as somatotrophine hormone, that is GH and STH. Thyroid stimulating hormone TSH, the thyroxine, thyroid, okay, and adrenocorticoid hormone, that is ACTH, follicle stimulating hormone FSH, and luteinizing hormone. So these are the hormones like where follicle stimulating and luteinizing hormone is like in the female, like more commonly during uh, periods time, and then the rest will be like in all general male and female. Posterior hormone like oxytocin is an hormone, and antidiuretic hormone. So these are the different hormones, which is like pituitary gland, which is produced by the anterior region of the pituitary gland, and there's a posterior region of the pituitary gland, which produce a different hormone like growth hormone TSH, ACTH, FSH, LH, oxytocin, and antidiuretic hormone ADH. Thyroid hormone produces like thyroxine, T4, triiodothyroxine, which is T3 and T4, parathyroid hormone, which is produced by parathormone, pancreas, which produces insulin and glucagon, pancreatic cells, and adrenal hormone means like adrenal corticoid. Like here, we know that from the figure, the adrenal means like the adrenal gland, which is above the, which is say above the the fat substance, fatty thing which is above the kidney. Okay, so that is something, adrenal gland. So here this adrenal gland, which like here again, here it's three, cortex, medulla, and gonad. So here this adrenal gland is having like suppose three layers. Say example, so this is the adrenal gland, and this is suppose the kidney at the bottom, and the adrenal gland. So here it's like the three different layers will produce like cortex, medulla, and gonad. So this cortex, medulla, and gonad. So here in these three different layers, they produces different hormones like glucocorticoids, mineralocorticoids, the steroidal things which is produced for the internal repair, and sex steroids. And medulla, that is adrenaline or noradrenaline, is produced over here, and estrogen, testosterone, and progesterone, etc. The hormones will be produced by the gonads of the uh, adrenal glands. And hormone-related growth factors, the growth effect we here in the case of growth hormone. The growth hormone, where this growth hormone is secreted from, the growth hormone is secreted from pituitary gland, isn't it? So here, what is this pituitary gland? The major role over here is to stimulate the growth directly into the conjugated with other hormones, and hyposecretion of during childhood leads to dwarfism, means decreased secretion of this growth hormone in the childhood will decreases the height. Excess secretion means hypersecretion may leads to the giantism, means like increased height and like increased body mass, heavy body. Hypersecretion in adult, that may leads to a acromegaly, that is something uh, say 7 feet height, for example. It is characterized by the excessive growth of facial bones, hands bone, and large spade skin, and thickness of the facial and hand skin. The next is somatotins. It is a peptide inhibit that release of the growth hormone like TSH, prolactin, insulin, and glucagon. And thyroid stimulating hormone, the TSH, that controls the growth and the activity of the thyroid gland. It influences like uptake of iodine. The major role play is by iodine. Synthesis of thyroxine and triiodothyronine, that is T3, by this thyroid gland, and their release into the bloodstream. Adrenocorticotropin hormone, that is ACTH, that controls the growth of adrenal cortex and the synthesis of corticosteroids. These glucocorticoids, cortisone, and hydrocortisone main function is to regulate carbohydrate metabolism. Mineral corticosteroids, that is maintains of the electrolyte balance in the body. This is like 8 ACTH, glucocorticoid and mineralocorticoid, and thyroid stimulating hormone, which is showing the function. So this is all about the drugs which is used in anti-diabetic. So here what we have seen previously, we have seen the drugs which is used in the case of what is diabetes mellitus and what is insulin, and insulin is a hormone, and types of diabetes mellitus, and the drugs which is used in the case of type 2 and type 1 type of diabetes like insulin and some oral anti-diabetic drugs. And with this, like if suppose if a patient undergoes hypoglycemic condition, so in that case we have seen the drug, the glucagon, the glucose supplement will be given in that case when the patient will be unconscious, and the dental implication like problem or issues that may arise because of excess of diabetes, excess of glucose concentration in the body, in the blood. And we have seen a brief introduction about the glands that produces hormone in the body and what are those hormones and how they are affecting the growth and the proper metabolism and the other functions in the body. Like, okay, so this is about today's. Thank you very much. And if you have any doubts or anything, then we'll just later on let me know, then we'll try to clarify like in much more detail. Okay, thank you very much.